Let's talk about wind cold invading the lung. An invasion of wind cold is an acute pattern that does not usually last for extended periods of time. The wind cold either being quickly expelled from the body or transforming into heat and penetrating deeper into the body. It is nevertheless important to diagnose and treat this condition correctly. Furthermore, it is important to remember that it is the symptoms that define a pattern of imbalance. If a person manifests with symptoms of wind cold, then there is wind cold. This is relevant, for example, in the diagnosis of hay fever and other allergic reactions. So the concept here is wind cold invading the Wei-Qi level of the lung system and impairing the lung dispersing function. The key symptoms for wind cold invading the lung are cough, clear watery sputum, along with symptoms of an exterior wind cold pattern. Clinical manifestations are cough, clear watery sputum, aversion to cold with slight fever, stuffy nose with clear watery mucus, absence of sweating, head and body pain, thin white coating, a floating and tight pulse. Analysis, this pattern is mainly caused by the exterior wind cold pathogen invading the Wei-Qi level of the lung system and impairing the lungs dispersing function. There will be a powerful qi or pathogenic factor that has been potent enough to pierce the body's Wei-Qi. The invasion can arise if the person has been exposed to climatic wind or cold, but it can also arise after exposure to artificial air conditioning. Furthermore, some allergens and pollutants can also provoke a wind cold pattern of imbalance. There may be an underlying Wei-Qi deficiency, which means the pathogenic factor does not require the same strength to be able to penetrate the body's defenses. So the etiology is exposure to exterior wind and cold, relative weakness of the body's qi in relation to the pathogenic factor. Signs and symptoms, again, would be aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose with clear watery discharge, sneezing, occipital headache, body aches, absence of sweating, heavy voice, itchy throat, cough, absence of thirst. And of course, the pulse would be floating and tight. Tongue has thin white coating. Treatment principle is to dissipate wind cold, diffuse the lung, and suppress the cough. Acupuncture treatment, we use lung 7 to release the exterior, expel wind. Gallbladder 20 to expel the wind, as well as do 16. Bladder 12, we use cupping to expel wind and to release the exterior. Sanjiao 5 to expel wind, and this can benefit the head. We use Li4 to release the exterior and bladder 13 to suppress the cough, regulate the lung qi. We needle using drainage or sedation. If there is headache, we add Do20 and Si3. For absence of sweating, we add kidney 7. If there is nasal congestion and runny nose, we add Li20 and the extra point Intan. For cough, we add bladder 13 and bladder 11. When there are invasions of wind cold, it is advisable to consume beverages that are hot and spicy to open the exterior and expel the xia qi. This could be, for example, ginger, garlic, whiskey, brandy, or chili. Fasting is also advisable, or only eating soup such as onion soup. There are two reasons for this. First, when temporarily fasting, qi will not be used to transform food and therefore can be used to combat the invading pathogenic factor. Second, some sources say that the downward movement of food and qi in the stomach can draw the exogenous pathogenic qi inwards from the surface.